The volume of both benign and malignant tumors of the thyroid gland has increased rapidly over the past several decades. The incidence of thyroid cancer has increased faster than any other cancer in the United States. Fortunately, the prognosis from this disease with respect to survival is outstanding. However, the potential for complications from the surgery, as well as the potential for developing recurrent disease that will negatively impact on the patient's quality of life is significant. Establishing the correct diagnosis at the outset and determining the proper course of actions depends upon accurate assessment of biopsy material. This can often be very challenging, and it is not uncommon that our review of biopsies leads to a different interpretation and a very different set of recommendations for the patient. When patients have biopsy-proven or highly suspicious nodules, it's imperative that the surgeon accurately assess the extent of the disease so that the appropriate procedure will be performed. That way, the patient goes into the operating room well informed about the extent of the surgery that's required. It is not uncommon that the surgeon encounters intraoperative findings during a thyroidectomy that leads to a change in the scope of the planned procedure. This may involve the presence of invasive disease that extends outside the thyroid to involve surrounding structures, including the nerve to the vocal cord. The ability to deal with those problems and to be able to not only remove the entire disease, but also to render the patient as functionally intact as possible is vital to the outcome of the procedure. The failure to address these problems appropriately can leave the patient with residual disease or a functional deficit that could potentially have been avoided. The removal and the repair of portions of the larynx and trachea or microsurgical repair of nerves may be required to achieve the desired results. Having the skills and the experience to deal with any unforeseen problem during the initial procedure can make a great difference in the patient's prognosis and their quality of life.